welcome back to another Eye Care for Your Brain with me, board-certified neuropsychologist Dr. Karen Sullivan, bringing you high-quality brain health education so you can be your own best advocate. Tonight we are talking about Xanax, the good, the bad, the ugly. If you listen all the way through, I promise you that you will learn critically important information about this medicine, including the top 3 worst things about Xanax that I know of as a brain health doctor. Xanax is also known as alprazolam. Now, alprazolam belongs to a group of drugs that we call benzodiazepines, which are in a class of drugs that we call anxiolytics. Alprazolam is a drug where if you track the prescriptions over time, it has been exponentially higher. So if we look from the mid-1990s to the mid-2010s, we see an increase in prescriptions by 67%. That is pretty significant. We also see an increase in the quantity of the doses that are prescribed. This has increased over 3-fold in that same time period. Prescription rates for Xanax increased by 9% every year that you track it since about 2008. Now, part of this is because in the United States, the psychiatric care of people, mental health care, really started to shift in the 1990s from specialty providers like psychiatrists to primary care physicians. And today, over 90% of all benzodiazepines are prescribed by primary care doctors. So if you have a prescription, chances are that's where you're getting it from. Xanax was first developed in the 1960s and brought to market in 1981. So my first question would be, well, how do they work? All benzos work, we call them benzos, benzodiazepines, work in a very similar way. They increase the presence and enhance the effect of a neurotransmitter called GABA. Now, as a result of more GABA, neurons, brain cells, are less excitable, they fire less, and people feel that calming, kind of anti-anxiety relieving effect. Now, in the brain, we have 2 different types of neurotransmitters. We have those that are excitatory, and we have those that are inhibitory. You can kind of think of them like your gas pedal and your brake pedal. So sometimes brain cells fire, and other times they actually hold back and put the brakes on. So excitatory neurotransmitters do exactly what you would think. They increase electrical activity, and inhibitory neurotransmitters do the exact opposite. They stop electrical activity. And for optimal brain function, we really need a balance of excitatory and inhibitory at the right time for the right task. So too much excitation in the brain causes things like seizures and agitation, and too much inhibition causes things like sedation. That's what we use in anesthesia to really reduce consciousness. So when we are highly anxious, part of how it gets kind of hardwired in our nervous system is that we have too many rapidly firing brain cells in a part of the brain, specifically called the limbic system. And sure enough, even though GABA receptors in the brain are fairly widely distributed in a variety of places in the brain, they have the highest concentrations in the limbic system, which actually makes a lot of sense. So this is the part of the brain, you've probably heard of it, where emotions are really generated. And this is where we also store emotional memories, okay? So this is where in the brain and how in the brain Xanax really calms people down. So in addition to the calming effects, Xanax is also used for other therapeutic purposes. So you might be on Xanax because it is also a hypnotic and it works for sleep. It can be anesthesia in a very light sense, working on chronic pain. It can be an anticonvulsant, which is where it helps with seizures, and it's also used as a muscle relaxer. Xanax is unique from other benzos in that it also reduces the body's ability to synthesize adrenaline. So as doctors, the way we think about Xanax is that it is a quick on, quick off activation pattern. So what that means is it starts to work almost instantaneously, which is what makes it a great candidate for acute anxiety like panic attacks, but not so good for people who are prone to addictions because that quick on and quick off really activates the reward pathways in the brain. Xanax comes to its peak within about an hour to 2 hours, depending on the dosage, and it has an average half-life of just about 11 hours for most people. Now, there is a range from 8 to 26 hours, depending on your age, your kidney and liver function, your hydration level, and of course, how much of the Xanax you're actually taking. So if you take it through a pill, it's absorbed in your stomach and your intestines, goes into the blood, and from there crosses the blood-brain barrier, reaches the brain, having its calming effects. Now, the dosages, when you get it from a prescription, range from 0.25 to 0.5 milligram tablets. And usually on the bottle, you'll see it says prescribed up to 3 times a day. Now, one of the first learning points in this lecture today is you don't need to take it up to 3 times a day to be effective. A lot of people want to do just what the doctor ordered, but really think of that as an as needed. The goal with Xanax is you really want to use the lowest possible dose to reduce or eliminate the disabling aspects of your issue. So if that's anxiety, only the part of the anxiety that keeps you from life, that causes you suffering. Getting rid of all anxiety is not realistic. Anxiety is normal. It is a very important evolutionary biological function, which is basically a warning sign that something is wrong. So it might not be obvious to you in the moment what's wrong, and that's exactly what happens with panic attacks. You think it comes out of the blue, but the system can get tripped up over time. So what maybe started off as a genuine anxiety issue becomes highly associative over time, and certain places, certain people, certain internal feelings can really trip off that feeling of anxiety, and now you're kind of in this horrible hole, and many people do need low doses of Xanax during a short amount of time to really get out of that hole. So no matter what the reason, remember, anxiety is really asking for your attention, and it is our job to listen. So Xanax, like I said, you really want to think about using it over a short amount of time. It is metabolized by the liver, which is the largest digestive gland in the body, and it is filtered out through the kidneys, and we get rid of it through our urine. The liver's most important job is whole body detoxification. So anytime we give it more jobs to do, we are risking a little bit of liver damage. And I think that's really important that you know that if you have to take Xanax. One of the most important things to know is that when we start to mix Xanax with other substances, particularly alcohol and opioids, this is when people really get into trouble. The research, if you look on people who just take Xanax as prescribed, it's really not that bad. There are some tolerance effects we're going to talk about later today, but really the problem becomes health-wise when you start mixing it with alcohol and opioids. So one of the big things to know is, do you have any other types of liver dysfunction? The biggest one in Americans is fatty liver. About 40% of Americans have this, and basically it's when there's too much fat in the blood, the liver has the ability to pull it out and basically package it, and it becomes these little circles you can see on a liver ultrasound. So making sure you're managing your blood fats, your cholesterol, your triglycerides is key if you take Xanax. Losing also even just a little bit of weight can be a very powerful way to support the liver. So losing just 5% of your body is the tipping point for improving liver function. If you have to lose, and you do, between 7 and 10, this is when you can really see 7 and 10% of your body weight. This is when you really get to see decreased inflammation, and you can even reverse some of the damage that has happened to your liver. But what is so key is, if you do have some weight to lose, only do it slowly, 1 to 2 pounds a week maximum. Anything more than that, you're actually going to worsen inflammation and fibrosis in the liver. If you take Xanax, you do need to prioritize this liver health. So I want you to think about eating as organically as you can afford. Pesticide residue is also processed in the liver and creates an increased burden. We also want you to eat more cruciferous vegetables. So this is your broccoli, your cauliflower, your Brussels sprouts, your cabbage, and kale, because they all contain compounds that enhance the liver's ability to cleanse the blood. An apple a day is also great advice, as there is polyphenol extract in apples that also helps to protect the liver. liver. Good hydration cannot be overestimated in liver health and kidney health. So again, if you do take Xanax, if you take it responsibly, there's no shame in it if you need it. There is the responsibility, though, I think, to make sure you're taking it in the most healthful way possible. So I promised you the good, the bad, and the ugly. So let's start off with the good. Xanax is incredibly helpful for some of you. If you have chronic, debilitating anxiety, particularly from trauma, trauma is cumulative. The hardest type of trauma is when at the time we were either literally immobilized or there was a sense of emotional helplessness in a way of not being able to escape. This is what we know really leads to kind of the deepest, long-standing trauma anxiety that we carry in our body. If you have insomnia to the point where you literally can't sleep for a day, 2 days, 3 days, you may need some appropriate type of Xanax. We also know that it is tremendously helpful in people who have certain genetic disorders in which the sympathetic adrenal system and the hypothalamic pituitary axis, the HPA axis, is overregulated. So sometimes this can happen in neuroendocrine disorders. You've probably heard of adrenal gland tumors. These type of things can only really be helped by something like Xanax. So the FDA label indications are for panic disorder, generalized anxiety disorder, and people use it most often off-label use for insomnia, PMS, and depression. So that's kind of the good. It does work for some people. The bad, of course, is the adverse reactions that we have, right? So what we typically see at the beginning of Xanax therapy is people can be quite drowsy, quite fatigued, but some people also get a little bit of confusion, headache, nausea, tachycardia, which is where your heartbeat goes over 100 beats per minute, hypotension, where your blood pressure drops less than 90/60, or blurred vision. What we really get concerned about, though, is tolerance with Xanax. And if you take Xanax, please listen to this closely. This is extremely common, even if you take Xanax regularly within 1 month, okay? So what this means is the body adapts to this medication very quickly, and we need increased amounts over time to have the same effect. Now, why this is so important for you to know is that over time, people often complain of more and more anxiety on the same dose because they actually need more to get the same effect. So if you go to your doctor and they're not too savvy about benzos or mental health, they may interpret this as more baseline anxiety as opposed to tolerance to the medication, and they can prescribe a higher dose, which ultimately just leaves you chasing the anxiety until you're so high that this is the risk for addiction. So some classic tolerance symptoms to be aware of are needing more and more of the Xanax to sleep or not be panicked, having some type of memory loss. Remember, I said those GABA receptors are in the limbic system, which houses emotional memories in particular. Also, if you are starting to feel a high level of anxiety when you leave your house, leaving the comforts of your own predictable space, called agoraphobia. We really don't like to see Xanax use in folks over 65 because the lower metabolism, because of the just wear and tear on the liver and the kidneys. So we think, we know from the research that there's an increased risk of dizziness and falls, too much sedation, and confusion. You should avoid grapefruit juice with this medication. You've probably heard of there's meds you shouldn't take with grapefruit juice. Well, guess what? The Xanax in your body can actually go too high because you're blocking the liver's ability to break down the medication. The most devastating effects of Xanax, of course, are addiction and abuse. Third most commonly prescribed prescription substance abuse is Xanax in adults and adolescents. 4 out of 10 people who take it will develop a physical dependency on the drug after just 6 weeks. The average person who is addicted to Xanax takes 20 to 30 pills a day. So that's helpful if you're listening and you're concerned, like, oh my gosh, I take it twice a day, am I addicted? Chances are no. Benzodiazepine overdose death most commonly happens when you combine it with that alcohol and opioids. So if you track these deaths, the amount of overdose deaths in which benzos were a factor rose by more than 400% from 1996 to 2013. That's pretty scary. And ER visits related to benzos rose by more than 300% from 2004 to 2011. Addiction is characterized by a feeling of compulsion, like you need it, you have to have it, you're going to be desperate if you don't get it. And what you really want to think about is your role fulfillment, right? So are you living up to your expectations that are consistent with your values, that you're proud of at your life roles, work, school, being a parent, being a sibling, being a friend, being a spouse? Are you spending more and more money or time thinking about Xanax? Are you having more conflict with people? And probably the most telltale is, are you just more apathetic to life because the Xanax has kind of become your sweetheart, your one and only? Overdoses, like I said, with Xanax are extremely common once you start to add in the hydrocodone, the oxycodone, the fentanyl, and alcohol. So that is really something to avoid. There are a group of people that are at highest risk for misuse. Not everyone who uses Xanax is going to become addicted. It's really important to know that. And you don't even have to become one of those people that has a tolerance if you understand how to use it, which is acutely in as low of a dose as you need for a short time period to get yourself back on your feet and get treatment for the issues that are causing you to be highly anxious. Xanax can be a very useful tool in your toolbox for a debilitating condition that requires some degree of calming. But we do have vulnerable groups. The number one vulnerable group are folks that have a history of substance abuse disorders, right? That makes sense. If you have ever been addicted to something else, your chances of becoming addicted to Xanax go up 24 times. That is really a lot. And if you are a young adult, 18 to 25, 49% of teens have reported taking Xanax at least once, which just kind of blew my mind when I read that. If you have a history of suicidal thoughts or attempt, this is probably not a good drug for you. There is a black box warning on it for those symptoms. And the last group I think is most vulnerable is people who are uneducated, who don't understand Xanax, who get the prescription really quick, and the doctor doesn't sit down and have this type of conversation with them, which is harder and harder given the shorter and shorter times we have with our medical providers. So just by listening to me today, you are reducing your risk of misuse. The other things you want to think about is how much trauma you have. Other research has suggested the more introverted you are, the less coping skills you have for conflict resolution, that these are the folks that are at increased risk. And part of it is because the Xanax works so well that it does give you this feeling of kind of taking away all your problems, but it's really not a long-term solution. The final thing are our genes. Our genes really determine how sensitive we are in our reward pathways and how intense the experience of dopamine release is going to be to any substance, Xanax, alcohol, opioids, whatever. Now here we have our ugly. This is the top 3 worst things you need to know about Xanax. First one, I've already alluded to it. Do not combine Xanax with alcohol or opioids, please. 33% of all fatal opioid overdoses included a benzo, most typically Xanax. Alcohol increases the concentration of Xanax in your blood and your brain and pretty much takes away that inhibitory control, those internal brakes. So not only can you say dumb things you're going to regret, but you can stop breathing. The part of your brain that is responsible for respiration can stop working, and you can have significant memory loss. I see that often as a neuropsychologist. The number 2 ugly thing about Xanax is abruptly stopping it. Do not do that. You do not want to live through that experience. After about 24, definitely by 48 hours, if you do have a dependency or if you're addicted, you will feel horrible. You will have a feeling like you have the worst flu of your life. You could have seizures. You could die. You could have severe agitation, psychosis, headaches, tremor, inability to sleep. The longer you've taken Xanax, the higher the doses are that you've taken, the more you need to be aware of how to successfully come off Xanax. And that is only going to happen with the support of a professional. So please reach out to someone. I'm going to give you a 1-800 number when we're done talking today. At least you have some place you could call if you need it, okay? Actually, let me give it to you now. National helpline in the U.S. for all substance abuse, a great confidential free service, is 1-800-662-4357. Please give them a call if anything I've said today concerns you about your relationship with Xanax. Now, the third one is that chronic long-term use of all benzos, including Xanax, does raise your risk of dementia. Now, that concern is so significant. It's so important, especially to people over the age of 65. And I'll tell you, women over 65 get the most prescriptions for Xanax in older adults, probably because we're more comfortable expressing mental health concerns. We don't have to kind of put that stiff upper lip when we go into our doctors. We're a little bit more willing than men, stereotypically, to express that we are struggling. And probably doctors are a little bit more used to writing prescriptions for mental health issues for women, just through, lingering gender stereotypes that still exist today. So if you're a woman over 65, you really need to understand the relationship between Xanax and dementia. And because that's so important, I'm actually going to do a whole nother lecture on it next week. So if that is something that interests you, please check in with me next week. I would love for you to subscribe to our channel. If you think this type of in-depth, helpful, evidence-based brain health information is something that you like, please come aboard to our I Care for Your Brain community. Also, we would be so grateful if you would help us spread the word about what we are doing here. Our goal is to provide a free service to the public so that they can have an objective, trusted brain health guide to make some very important decisions in your life and for your quality of life. Thank you so much, and I'll see you next time. Bye.